Hello everyone, Dr. Mark here with you again, and today I want to talk to you all about a method of heartworm treatment that is not discussed nearly often enough. I discussed this with a person recently when she sent a question to my Ask a Vet column at the website yourpetsathome.com. The site has some great articles on common health issues in dogs and cats, details on how to care for your pets, fun articles about dogs and cats, and also has expert trainers and breeders writing for the site. Anyway, here is the question that led to the article. Dear Dr. Mark, I run an animal shelter and recently picked up an older dog that tested positive for heartworms. Our vet suggested the slow kill heartworm treatment with Advantage Multi because of her age. Everything I've read says to give doxycycline for 30 days first with this method, but he is just prescribing the Advantage Multi alone. I'm just trying to get a second opinion as to whether that is advisable and would gladly pay for it. She is not coughing or showing any visible symptoms at all. In case it matters, she had surgery 3 weeks ago to repair a broken femur and goes back tomorrow for her first checkup post-surgery. He said not to start the Advantage Multi until after he sees her tomorrow. Any advice you can give would be greatly appreciated. My answer was: thank you for your diligent work at the animal shelter and for giving exemplary care to our senior canine companions. We appreciate your dedication. It sounds like the dog is a good candidate for the slow kill method of heartworm treatment, as she does not yet exhibit signs such as coughing. You are correct in that the doxycycline is recommended, as research has shown that there are better kill rates, for the heartworms, when used. There are some side effects in some dogs. For instance, an upset stomach, but they are nowhere near as severe as the broken femur or the heartworm. I would start at 10 mg per kilogram twice daily, but if she has trouble with that dose, try to split it up. Your vet may want to start her as soon as he sees her, since they usually start treatment at the same time as the Advantage Multi. If not, ask for a prescription and give it to her from day 1 through day 30. Doxycycline and minocycline, both tetracycline antibiotics, are effective in reducing the bacterium Wolbachia, which is found in and necessary for all heartworm life stages. Essentially, eliminating the Wolbachia bacteria makes the dog's system inhospitable to heartworms. When vets combine it with moxidectin, this treatment protocol has successfully converted heartworm-positive dogs to antigen-negative, heartworm-negative. A study that I used in this article demonstrated that this treatment regimen successfully eliminated the immature heartworms by 21 days post-treatment, 30 days of doxycycline combined with 10 months of Advantage Multi. It also reduced heartworm antigen concentration over time and had a 95.9% efficacy in the elimination of mature adult heartworms. Based on this study, they concluded that this treatment regimen is actually a relatively quick, reliable, and safe option to treat canine heartworm infection. This is compared to other treatment regimens involving macrocyclic lactones. Particularly so, when the medical community's preferred treatment method, use of the drug melarsamine dihydrochloride, is unavailable, contraindicated, or declined by an owner unable to afford the more costly treatment or concerned about the potential side effects. Many sources, including the Heartworm Society of America, list the 3-dose protocol of 2.5 mg per kilogram melarsamine dihydrochloride as the treatment of preference for heartworm elimination in dogs. However, this protocol requires 3 injections, following treatment with doxycycline. The melarsamine protocol can cost between $500 to $1,500, while some pet insurance companies estimate that costs can rise to $6,000 for the successful elimination of heartworms. In contrast, the Advantage and doxycycline method should range from $350 to $450 for preventatives, medications and antigen testing. Considering the nature of heartworms, it is recommended that dogs stay on heartworm preventative year-round. If we are keeping the dog on a year-round preventative, the additional cost of the doxycycline and vet visits means the cost of the heartworm treatment alone is $175 to $230. Considering the slow kill method is highly effective and just a few months longer than the preferred protocol, use of the drug melarsamine dihydrochloride, I would highly recommend the slow kill method for most dog owners. Thanks for watching. If your dog has a heartworm infection and you need some advice about whether or not to use this type of treatment, leave a comment and I will get back to you as soon as possible. If you have any other health questions, you can leave them at my Ask a Vet column at yourpetsathome.com. Please be sure to make the question as clear as possible and let me know the dog's age, sex, breed, and the results of any tests you have had done. The more information you provide, the better the answer I am able to give. If you liked this video and it was helpful, please give it a like and subscribe to my channel.